Yeah,
Please
sure.
allow me to take honors in introducing our uh, uh, best speaker, probably Dr. Ram Mohan Jaiswal, whom I have had a very good fortune in meeting him in 2017 for the first time when I was in Jaipur. Dr. Ram is a professor and director at Blood Center Flowcytometry and Transplant Immunology Lab at Mahatma Gandhi Medical College and Hospital in Jaipur, India. He obtained his MBBS from Ganesh Shankar Vidyarthi Memorial Medical College in Kanpur in 2001 and subsequently did his MD in pathology from Sarojini Naidu Medical College in Agra in 2007. He has been a passionate learner and has been instrumental in working on integrated transfusion services for over 1.5 decades. He developed a state-of-the-art transplant immunology laboratory with flow cytometry and next-generation sequencing services. And he has been instrumental in assisting in the clinical term with deceased and live donors for renal, liver, and heart transplants, with ABO incompatible renal transplant and peripheral blood stem cell granulocyte collection and therapeutic apheresis procedures in critical diseases. He has been awarded several awards with excellence from various societies, including the AFIA, ASHI, and the most prestigious being the George Washington University. He has been not only an active member for various societies, he has also been a founder. A founder of a few societies, including the ISBT and AABB. And he has been a member of Bioclues and the Genesis Clinician Consortium of India, which we started. He has more than 20 papers and received several prestigious bursaries, including the histocompatibility immunogenetics conferences that were held over the years. His large research interests have been apheresis, cellular transplant, and transplant immunology with respect to flow cytometry and NGS. And he has recently received AABB quality certificate for blood center, which was put up at Mahatma Gandhi Medical College and Hospital. So this short and not so what you call much time taking words, so that we can in fact know more with Dr. Ram. I take a great honor in inviting him for this Sciversation with me. We'll have his talk for the first 10 to 15 minutes, and then we'll have some questions that will be extempore and some questions from the audience as well. Thank you so much, Dr. Ram, please.
Thank you, Prash, and thanks for inviting me and giving me this opportunity to interact with all of you. First, I am going to give some brief introduction about my hospital, from where I started my journey of research, academics, and innovations. Right now, I'm also taking care of Innovation Society, Innovation Council of our institute. So that is a very important thing from where I begin my journey. So just I am giving a small introduction of my institute and my department. In fact, our main theme of our department is we are connecting lives to provide hope for healing by advanced transfusion services. Because when I started my MD, at that time we saw there are a lot of crunches of blood units, and even if the people are getting the blood unit, they are most of the time they are not safe. If they are safe, so there are certain, you can say certain phenotype, genotype, and certain antibodies which is not commonly performed even in the good blood center. So with that theme, I started my journey to robustness of transfusion services, as well as to integrate various subsections of hematology under one roof. And this is the vision and mission of my blood center. It is to provide best-in-class, safe, secure, and a cost-effective, hassle-free supply of blood products and perform a critical service to meet the needs of the healthcare community, patients, and our donors through advanced transfusion services. And to be center of excellence of blood transfusion services by providing safest possible and clinical application that ensures the highest quality product and services with operating efficiency, donor satisfaction, and patient care. This is the milestone. This blood center is established in the 2001, and just I am giving a small introduction of our emeritus chairperson, sir, Dr. M.L. Sonkar, sir, who is the man of vision and who established this medical college in 2000. And I joined sir in 2007, and after that we started various activity in our blood center. We got the component license, we got the platelet pheresis. Normally you heard about the dengue season, and most of the time dengue season we require a platelet. So that HDP unit is we are collecting from the platelet pheresis. In 2015, we started our transplant immunology lab, and in Rajasthan, we performed first disease donor transplant, the disease donor for the kidney transplant, and then we started ABO incompatible renal transplant. We got NABH accreditation of blood center. This was the first blood center in the state, medical college blood center in the state of Rajasthan, which was accredited with the NABH. Then we got the NABL accreditation of our HLA lab. NABL accreditation of HLA lab is a very unique, because again we are the only lab in the state of Rajasthan which is accredited for the HLA lab. Most of the lab are accredited for the different parameters, and as per Transplant Human Organ Act of 2014, any lab who is accredited with the NABL, they are the only authorized to give some kind of Form 5, which is help in the authorization, which is helping for the authorization committee to establish the relationship. And we also participated in the Placid trial, because we are all witness of the COVID. And COVID we took as a great opportunity to for the various research, for various antibody tests we are doing. We had done at that time. We participated in the Placid clinical trial that was governed by the ICMR. Then after COVID, just we moved to the bigger center, because our chairman sir said there is so much work in the transfusion services we are not aware. So after seeing our work in the hematology and transfusion services, we got one of the biggest space in our university for to run all the transfusion, transplant, and various academic activities, because we are also starting some kind of international certification, and we are in touch with the various international societies to for the academic excellence and to empower our students for the meet the global standards. And recently we got the American Association of Blood Center certification. This is the again one of the first certification by the ABB given to the blood bank in India. And we are fortunate enough, by the blessings of God, by the blessings of all our patients, and by the blessings of all our donors, we are able to maintain our quality which meets the global standards. This is the fast forward. We are the one of the dedicated center in the during COVID time, and we are having all the key transplant program, which includes solid organs. Solid organs includes kidney, liver, lung, and heart. And we also started stem cell transplant program, which we are doing autologous for usually for multiple myeloma, Hodgkin's disease, and for allogenic for usually for aplastic anemia and AML. And what kind of services we are providing here? This is the world class services in terms of infrastructure, in terms of equipment, and in terms of, you can say, to meet the global standards. That is the very important when we are running these kind of program. So we are, and I'm really fortunate to have our management, which is always supporting to us to provide, to meet the or to cater the need of the society to in the best possible way. This is the overview of our department. We are sitting in the hematology tower. Right now, I am sitting in the second floor. This is my office. And this is the 11th floor building, which includes various blood, 2 floor for the blood center, central lab, and BMT units. And we are the academic distinctiveness by this certification of ABP. And as we already mentioned, we are the first one who got the NABS accreditation among the medical college based blood center. And we are the only 3 blood centers in India right now which are having the hemovigilance nurse. Hemovigilance is the term used for the monitoring of the all transfusion activity from vein to vein, from the donor vein to the recipient vein. And This is the various activity which is recognized by the National Institute of Biological, which is the part of Ministry of Health and Family Welfare. And these are the certain important point when we started our ABO incompatible renal transplant. We did therapeutic pheresis for Crigler-Najjar syndrome. That is very one of the very rare disease, and we got a good result. And these are the various social institutional distinctiveness which we are doing: HLA testing for disease donor, Form 5 for live organ donation. We also involved in the intrauterine transfusion. In intrauterine transfusion, meaning we are giving transfusion in utero. So that is again, it is our expertise to prevent the fetus from premature demises, especially in the case of HD and hemolytic disease of newborn. We are collecting granulocyte, we are collecting hematopoietic peripheral blood stem cell, and this is again highlighted by the various media for intrauterine transfusion when we perform 4 years back. This is our granulocyte harvesting, first granulocyte harvesting when we started. When we started this autologous blood stem cell transplant program, and our institute is also recognized by the American Society of Apheresis, which recognizes our active role in the therapeutic apheresis as well as donor apheresis. And this is institute name, and this is me, which is got recognized by the ASFA, that is the American Society of Apheresis. And American Society of Apheresis is one of the global society which having all the maintain the data of apheresis around the world. This is the some pics of during COVID-19 where our colleague donated blood. I am putting this picture because the first picture shows this, he was the first donor of COVID plasma at our center, and after that we collected near about 500 units. And during COVID time we supplied plasma to every needy persons, not only in this state. Even we got the request from different part of the India, just like from Bangalore, from Kanyakumari, and from Jammu. So we are getting requests from across the India at that time, and we are fulfilling the needs of all the needy persons. These are the again some pictures, because at that time it was very difficult to maintain the inventory in our blood center. So we just promoted, we donated ourselves, we promoted each and every member of our staff to come and donate. So these are some kind of, these are the some pictures which highlighted the support of our students and our staff. We again this creating awareness at that time by different meanings. This is the poster made by our one of the COVID recovered patient, because he got the benefit from the COVID plasma, and when she returned after discharge from this hospital, she was the one of the also part of our team to create awareness, and she made this poster, pledge to donate plasma. This is again various activities, and this is support from all the army personnel during COVID time. And we also actively involved in various research. As I already mentioned, we are the part of the Placid trial. Our research was published in the BMJ, and we also did some study in the COVID antibody that was already published in the International Society of Blood Transfusion Science series. So these are the various research projects which we did during that time. This is the again ICMR notification for the participation in the Placid trials, and this is the media highlight at that time. This is the different research article which was published in different journals. Is the just a snapshot. And this is all. We also participated to create a guidance document for the COVID-19 plasma therapy, because most of the work, we recognize most of the work during the COVID-19 pandemic. So this was a great opportunity for our blood center, for our institute, and for me, because most of the opportunity we got in this period to collaborate with the international societies, to collaborate with the international researchers, and to show our research to the different, to share our research at different platforms. And during that time, we also got invitation from University of Alberta to collaborate for a research program during COVID. And this is after that we started our NGS, and we got one novel allele which was published in the Human HLA uh, journal. And this is the name of me along with all the international collaborators which identified and published, because there is a policy when you are getting any novel allele, we have to submit to the WHO for recognizing their nomenclature. And we submitted and we got the recognition of our allele, that is the 92. These are the various program. I am sharing this photo. I think most of you are recognizing Dr. Prash here. We invited him for our NGS workshop because we are very comfortable, and he's a very good friend of mine. He's a very, you can say, most of the feedback which we are getting after our workshop. So everyone insisted us कि whenever if you have any workshop in the future dates, just you invite this faculty. That is Prashant. And I am sharing this picture. I am sharing this picture because Dr. ML Sarkar, who is our emeritus chairperson, most of PhD students are aware of Dr. N.K. Mehra sir, who is also known as a father of HLA in India. These are the different awards. I am also an ABL assessor and an ABH assessor. I am also participating in different international committee for upgradation of academics and science. These are the different, and our future planning to develop international training center and start international certificate program in collaboration of various societies and models. One of them, cellular therapy and gene therapy. We've also wanted to start bone marrow registry. We are already working on it, and leading India by hemovigilance, and to provide international proficiency testing center for Asia Pacific countries for transplant immunology test. This is our campus, MGUMST campus, during the rainy season. And this is the quote of Mahatma Gandhi ji: the best way to find yourself is to lose yourself in the service of others. Thank you very much. Over to you, Prash.
Thank you so much, Ram. I mean, what a wonderful presentation. Very kind of you, for your scintillating words and very kind words, and then exciting and amazing works that you have done over the last, I would say, 2 decades. And friends, I have to give another compliment. Dr. Ram is so uncompromised that you'll be surprised to know that he's doing another PhD. Can you believe that? I mean, a doctor, a clinician who has already done MBBS, MD, worked as, a senior resident over the years, and worked as a director, is so down to earth that, somehow he has got that hunger. He says that, मैं उनसे मैं एक ही क्वेश्चन मैं पूछा था, मतलब 3 साल पहले की बात था, when I met him. He says, Prash, somehow I really wanted to do, I have a hunger. I need to do, something exciting with respect to, myeloid, tumors. And I don't know how much energy, that he gets. And during COVID times as well, you'll be surprised to know that he was at MGUMST for over 16 hours a day. I mean, he would hardly sleep, I would say, Um, uh, every one of us were, sitting inside, but he was the one, looking into the blood transfusions and looking into the apheresis and other things. But thank you so much, Ram. I'm quite honored.
Thank you.
I have some very few questions, Ram. From a scientist perspective, from a researcher's perspective. We in India are, I would say, limited by some kind of resources, towards the health policies.
Yes.
How do you think that apheresis, can be employed for resource limiting environments? Where are we placed?
Yeah, I think this is a very hot question for all the Indians. When I was doing my MBBS, so at the end of every topic, there was a lot of references. I always used to find the Indian name, and it was very difficult to find Indian name in the references at that time. Then I decided what was the lacunae. Then after that, I did my MD in pathology from Agra. When after finishing MD, when I joined this MGUMST, I wanted to pursue my DM in hematology, but some how the भगवान को कुछ और मंजूर था, मुझे नहीं मिला. फिर मुझे लगा कि why we should not develop some such kind of resources, some kind of technique, some kind of science, so that we get our recognition at global level. So with that thinking, I started working in 2007. And of course, when you decided something, there's a lot of things coming to you to support you, to guide you. And I am one of the fortunate guy in that sense. Because when I decided, whatever I decided, I make a Panchvarshiya Yojana, a small goals initially. First, I wanted to start to establish a good blood center, and in 2012, when we started apheresis program, so there are few blood centers which already doing that services, but our motto was to cater the need of each and every patient, even at the midnight. So I remember in 2013 when we stuck with the dengue epidemic. So I used to work 24 hours. Not me, even my all staff used to work triple shift, day, night, evening shift, day shift, and night shift. And after that, when we got to know we can make a small changes, then we switched over to the transplant immunology lab. And when we requested to our chairman, sir, ki, most of the time we used to need to send center outside to Jaipur. Jaipur is a big city, but at that time in 2014-15, these sample was sent to the Delhi. Then I started establishing. I took training with Meera sir and Uma madam. Started established lab. I developed resources. I got Flowcytometry. Then I got NGS. Now you imagine in a very first run of in NGS, when we run the very first sample during the validation, we found the novel allele, which I already shown. And when we submitted this novel allele to the WHO committee, that novel allele was very smoothly accepted, and I got my name along with the international committee. So most of the time we have to be passionate about what we are doing, and resources. मैं इमेजिन भी नहीं कर सकता कि 2013 में जो चीजें मैंने ड्रीम की थी वो सारी चीजें मैं अचीव कर पा रहा हूँ 2022-2023 में. तो रिसोर्सेज हैं, लिमिटेड हैं, बट वी शुड नॉट. हमको रिसोर्सेज भी, हमको बहुत सी चीजें ऐसी देखनी हैं जहां पर हम उसको डेवलप करें, और डेवलप करके, क्योंकि मुझे आज भी ऐसा लगता है कि इफ यू आर हैविंग गुड रिसोर्सेज इन टर्म्स ऑफ इंस्ट्रूमेंटेशन, in terms of advanced instrument, then it is not very difficult to pursue further for future research and all these things. And रही साइंस की बात, तो साइंस इज ऑलवेज अबाउट शेयरिंग. हम जितनी भी चीजें अभी हम कर रहे हैं यहाँ पर, तो नेटवर्किंग इज अ वेरी इंपॉर्टेंट पार्ट. तो यू शुड ऑलवेज कनेक्ट विद द राइट पर्सन एट द राइट टाइम. So that is one of the main message I wanted to give each our colleagues. Ki just you identify the right person, because if you find the right person, he or she guide you very well. And if you are passionate, believe me, if you are passionate about your subject, someone someday will come and pick you.
Wonderful. Wonderful, Ram. I mean, both say, I think, you made a perfect start with this. I completely agree with you. Ram, over the years, in fact, countries, every country is talking about, One Health policies, and for this, the seed division for any health policies, I think hematology plays a very important role. So, where do you see the role of One Health, and one country regimen, as far as India is going on, towards hematology?
I think one health policy, just like a one health policy, is a very important factor of our sitting government. They are working on it, and when we are talking about the health, so it is not a national kind of thing; it is a global kind of things. So that is one of the important perspective when we are dealing with the health. So suppose what standard is followed in the US, we are following the same standard in India in Jaipur. Okay, so this kind of, if we are thinking about this kind of one health, so it is not going to standardize most of the things. Yes, there is a lot of difference in the cost. That's why India leading in so many fronts. Even most of the international patient, they are not, who they are not able to afford costly treatment, they are coming to India. So right now, and I can see the metamorphosis of the health system in last 10 years. Even if I'm taking the example of Rajasthan, in Rajasthan, the first disease donor transplant program started in 2013. And just within 10 years, it picks very well. And right now, I think every month or every alternate month, we are getting one or two disease donor for donation.
Wonderful, wonderful. That's quite interesting. Moving forward, I mean, I've been very fortunate to have been introduced to aplastic anemia over the last 5 years. I've never worked on major disorders because I work on rare diseases and CA prostate and other things, and
Yes.
of course, cancer, colorectal cancer, and other things. But what amazes me is blood transfusion is a wonderful remedy. It is certainly a kind of a poor man's remedy. Instead of taking some eye hand drugs like ATG, rifampicin, and all those electromotorvac, all those expensive drugs for aplastic anemia at least. But I think from an internal perspective, or from a poor man's perspective, or especially from a rural perspective, many of these so-called villagers or rural people are not informed about these kind of things,
Yes.
the blood transfusions and other things, because of ignorance or those kind of things. What is your take on this? I mean, is it because we are still lackadaisical in these particular areas, or is it because our government is not really moving forward in strengthening these kind of activities?
Because aplastic anemia, most of the time, this is a very special diagnosis. It is not possible to make diagnosis at the PSC level. Some kind of, when we are talking about the aplastic anemia, there are a lot of things we need to be do. Especially, it is a kind of bone marrow failure syndrome.
Yeah, exactly.
And when we are talking about transfusion service, what is the role of transfusion in aplastic anemia? So why I am saying I am strengthening the transfusion services, because every blood is not the same.
True.
And most of the time, these patients of aplastic anemia may require transplantation in the near future. And we are transfusing normal blood. Normal blood means we are without reducing the leukocytes. And sometimes it causes alloimmunization, because aplastic anemia patient also require a special kind of blood. What is the special in that? We need to be reduce the leukocyte, and leukocyte is the mainly responsible for the transfusion reaction and for the alloimmunization, for the HLA development of HLA antibody. So most of the time in the rural setting, diagnosis is not made proper. Okay, these patients must be referred to the tertiary care center to make a proper diagnosis, because there's an n number of reasons for aplastic anemia, and aplastic anemia is basically presented with the pancytopenia. Okay, so n number of reasons for the pancytopenia. First, we need to identify this is the case of we are dealing with the aplastic anemia or not. And in the rural setup, this is not possible because of lot of expertise requires. So it is a better to all my PhD colleagues and all the doctors who is sitting at the periphery. If you are getting any pancytopenia, please refer to these patients to some tertiary care center or some higher center for proper evaluation, because after bone marrow transplant, it can be cured.
Excellent. Excellent, Ravi. Yeah, wonderful. I mean, this is what Dr. Sudhin Mehta, with whom we are very fortunate, to have been collaborated. He also suggests the same thing. But your answer is absolutely, taken in an absolutely higher sense, since you are a wonderful hematologist and you have been into this particular thing. Moving forward, Ram, please tell us about your myeloid cancer research. The wonderful oncomine array that you have used across your samples. What transpired, or what made you, to take up this particular work, towards your PhD?
Yes, it is a very good question because initially when I saw the cases of pancytopenia or any morphology slides, then we need to send the sample for further evaluation on the flow cytometry to see either it is a kind of neoplastic or non-neoplastic. Okay. After flow cytometry, if we are not getting any accurate answer, any proper answer, then we are referring to the some kind of RT-PCR. There are certain genes, or it is the EML80, is the RUNX1. What kind of genes these carries? Okay, then we thought an idea because as a pathologist, I am seeing the morphology. As a flow cytometrist, I am seeing the flow cytometry. But most of these complex kind of disease require the integration of reporting. It is always better. I was given the concept M2M. M2M means morphology to molecular. If these diagnoses made under one loop, there is a lot of correlation, and by this I inspired to work to started my PhD, and I took my topic on the myeloid neoplasm, because nowadays there are a lot of immunotherapies are coming in the market, and if we are able to identify the right gene, right mutation, disease, we can increase the survival of the patient or we can cure the patient. So this was the basic concept when why I started my PhD to in myeloid neoplasm.
Excellent.
There's a very spectrum. There's a lot of WHO recently released 2022 classification, that the fifth WHO classification of hematolymphoid. There's a lot of changes, and now this classification is based on the molecular profiling. Initially it was based on the morphology and cytochemistry, but after that, the myeloid classification is based on the molecular flow cytometry and morphology in combination.
Wonderful. Yeah. I mean, so given this particular thing, do you see a big difference towards donor apheresis and therapeutic apheresis in these hematological carcinomas?
Yes. Because donor apheresis, when I am talking about the apheresis we can divide into two categories. One is the donor apheresis, and second is the therapeutic apheresis. Donor apheresis may be for the platelets, and platelets may be required in the dengue, in the oncology patient, or patient who is receiving chemotherapy. One product is the platelet, second product is the plasma, which was witnessed during the COVID-19. This plasma is also collected by the apheresis. Then third part of the apheresis is the granulocyte collection. Granulocyte is also collected by the apheresis technique, in which we collect only the granulocyte, and most of the time the indication of granulocyte in the severe neutropenic patient, which is not responded to the conventional treatment. If patient is having absolute neutrophil count deficiency, then we advise for the granulocyte count. This is the another product of the apheresis. The another product of apheresis is the peripheral blood stem cell collection, which is the one of the most preferred method for the bone marrow transplant or stem cell transplant. Previously, we used to collect bone marrow from the our backbone in a general under the general anesthesia, under the OT setup. But right now, just we are giving some kind of GFCSF to the donor, or patient donor or donor. If we are talking about the autologous, the patient is the donor, and if we are talking about the allogenic, the donor is different from the patient. So we have to give some kind of medicine to mobilize the peripheral blood from bone marrow into the peripheral blood. And when we are getting these precursor cells or stem cells in the peripheral blood, we are collecting by the apheresis. So these are the donor profile. Now, therapeutic profile, we can use therapeutic apheresis in the GBS syndrome, that is the Guillain-Barré syndrome. We can use therapeutic apheresis in chronic myeloid leukemia patient when we are getting count of more than 4 lakh or 5 lakh WBC count. So this is the immediate measure. It is some to give some kind of symptomatic relief. We can use therapeutic apheresis. And the most important of a therapeutic apheresis right now we are doing for the ABO incompatible renal transplant, where we reduce the titer of anti-A and anti-B by these apheresis instrument, so that the barrier of blood group we can cross. It means previously what happened? Only A blood group patient can receive kidney from the A group of recipient, but it is not same in the present scenario. Any group of patient can receive any group of kidney from by this therapeutic procedures.
Wonderful. Wonderful, Ram. Yeah, thank you so much, for this wonderful thing. To those who know, naive audience, if someone do not know what is apheresis and all those things, that is wonderfully explained by Dr. Ram. It's just like taking the say single donor platelets, platelets from the blood and keeping it back, the remaining blood, back to the patient. That is what we call it as an apheresis. And research has been, steadfastly progressing in these particular areas, largely towards the blood cancers, hematological cancers. And there has been, various ways, methodological ways, that, hematologists or transplant immunologists like, Dr. Ram have been, working towards this. So I'll probably reserve one or two questions later, Ram, but, there's a question from Priyanka Sonar. Priyanka, would you like to unmute your microphone and ask the question?
So actually, my network connection isn't stable. So if you could just take it from
Sure.
the message,
Yeah, yeah.
it would.
So Priyanka asks in the chat box, Ram, Spearman and Mangold hypothesized embryonic organizer concept. Well, the graft was transferred from pigmented to non-pigmented host X. Why are immunological activities not triggered? In the same context, many articles state that Hill was a gifted student and had a knack for transplant surgeries. How can I work to inculcate such traits as a student since my precision in current experiments is still lacking perfection?
Okay. Basically, when we are talking about the transplant immunology, there's in transplant immunology, we always look for the some kind of antigen and antibody reaction in the donor and recipient. So most of the time, the compatibility is a very important when we are taking any graft. And just like we recently heard, there is a xenotransplant in the US where we take a pig heart and transplant it into the human body. But unfortunately, after a few months, patient was died. And so basically, when we are talking about the immunology, so there are a lot of n number of factors we have to keep in our mind.
Yeah. Yeah, I hope that answers your settled question, Priyanka. Yeah.
Oh yes, sir. Yes, sir.
Yeah, yeah. Thank you. Thank you for asking this wonderful question. And
And
also,
Priyanka, I'm a pure clinical background, so maybe you will not satisfied with me, my answer, but I am giving my answer in context with the clinical conditions.
Oh yes, sir. Definitely.
yeah. And in moving further, Ram, I mean,
So any tips to improve my precision in experimentations, like even with respect to transplantation?
Okay, so just I wanted to know, you were talking about the some kind of testing.
So testing as well as organ transplant because my
Organ
interest is in
transplant,
that, and
we
my
are
current subjects are also revolving the same.
basically in organ transplant. When we are talking about the solid organ, there are two kind of transplant. One is the solid organ transplant and second is the hematopoietic stem cell transplant. When I am talking about solid organ, it includes heart, liver, kidney. Okay, so there is a workup. We had to do HLA typing. We had to look for the HLA antibodies in the recipient. And this is a very you can say it is a very emerging topic, still in evolving phase. If you want to work in that area, it is a lot of scope in this area in a transplant immunology. And
Yes, sir.
basically, most of the time, what happened when we are taking any transplant. So there are a certain protocol we have to follow. Just like a one step is the authorization recommendation of authorization committee to establish the relation, especially in the solid organ transplant. And then we have to look for the certain antibodies the patient is not going to reject the graft which was going to be transplanted.
Yes, so clear.
Yeah, wonderful. Wonderful. Thank you, Ram and yeah, Priyanka. Ram, I mean, I know, as a doctor, you have a lot of patients, working for several hours. Were there any disagreements that you put it in an agreeable way with any of your colleagues? Were there any disagreements or any small type of, conflicts which you might have come across and which you smilingly evaded those, or maybe I've taken those disagreements in an agreeable way. I usually ask this question so that the young generation needs to learn how to disagree, or how to agree to disagree. That is very very
Okay.
important. Yeah,
Okay, and I think my answer on this, because when you are working, there's a lot of conflict may occur with your colleague because your line of thoughts, your working style is different from your colleague. But what my take on this? Be humble. Okay, because we are working for the science, we are not working for ourselves. It is not, we should not keep our personal ego in between. If suppose if there is a disagreement with our colleague, so we should respectfully accept it. Respectfully accepted, and just we need to be reviewed. Might be it happens because most of the time when you are so busy, it might be happen you miss certain thing, and we informed by our junior colleagues, this finding is also coming in this. So just I acknowledge his or her contribution. Ki thanks to me, otherwise this report may be missed by me. Okay, so sometimes and conflict on the basis of reporting. Sometimes when these conflict occurs, so what we did, just we discuss. We sit comfortably and we discuss with each other. And even if the problem is not resolved, so what we did, we are having certain mentors, also certain mentors who is senior to me, who is guide to me. So then we discuss with them. And most of the time, if you're not getting answer, so there's a high chances because it was the told by our mentor. There is a always 0.5%, 1% chances you will not conclude your diagnosis. So in that case, it is better to be follow. But the main important thing, if there is any disagreement with your colleagues or your peer group, just to accept it respectfully and very politely. Just to communicate, because communication is the one of the important key. Just to communicate with each other and talk to each other and come to the common consensus conclusion. But
wonderful,
be humble, and because these are the certain tool, just like a honesty is the best policy, integrity, confidential. There are a lot of very few important basic words. If you adopt in your daily routine behavior, so I think most of the problem will be resolved, and especially conflict of interest.
wonderful, Ram. Very well said. Thank you so much. Last one or two questions, Ram. I know during the COVID times you have done an amazing job, and I also recall the wonderful convalescent plasma therapy regimens that you have been attributing towards the placid trials, and the wonderful works that you have taken up towards inferring whether or not it's a moderate COVID or a severe COVID,
Yes,
or maybe less moderate COVID,
asymptomatic.
or all those kind of things. So, could you please describe our audience about this wonderful convalescent plasma therapy, and where do you see this particular thing the next few years?
Yes. So most of the hype during the COVID-19 ki plasma is a one of the panacea for COVID-19 disease. Then another article says plasma is deadly for the patient. But when we are dealing with the biological kind of things, biological samples, every individual is a different. Okay, so on the basis of severity, we can categorize asymptomatic, moderate, or severe, and these clinical classification is based on the symptoms of the patient. Even you remember few patients who were having asymptomatic, but all of sudden got severe COVID and is come. Okay, within a fraction of hours. Okay, so what we identified some HLA alleles. This study was not done in India, but in Italy they found 15, 15, 44, which is more prone for the COVID-19 for severity, and few alleles which helps in the asymptomatic presentation. So at that time, what we did, we restrict our. That's why we initiated our guidance document with all the masters in the transfusion services from the different state. We stated that only those patients, because we are dealing with the COVID plasma. And what is the COVID plasma? It is a kind of passive immunization. It is not active immunization. And passive immunization only works within the first few days of disease. If this plasma we are giving after the active disease, this is not going to be work. So the best time of plasma should be if it should be given within 3 to 4 days from the date of onset of disease. Then it is going to be work in a very good manner. Or if patient is having asymptomatic disease, so that the severity is not able to progress moderate or severe, then we got the very good result of COVID-19 plasma. Otherwise, it was not very effective in moderate to severe disease. ICMR also stated that in the and not ICMR, even the world leaders from John Hopkins, from Mayo, they are also we are also in touch with all the scientists who are working in the COVID plasma at that time, and we had the common consensus that plasma should not be given into the moderate to the severe patient.
Wonderful, wonderful, Ram. So, I mean, can we? I know, thanks to the wonderful immunization program that we have, we have also reached a kind of a herd immunity, thanks
Great.
to the wonderful, efforts that the clinicians like you and scientists, of course, have really put in, towards the immunization program, the COVID immunization program. I also speculate that there is a small account of, what do you call it, the diet regimen, that we, take, we Indians take the spicy, rich take, that kind of, adrak wala chai,
Yeah.
the typical, things that we take. That plays a larger influence.
Correct.
But at a certainty, let's assume, let's, God forbid, uh, uh, let's not hope that another COVID-like situation would come up. But if it may be, there could be such kind of situation. Do you think that the convalescent plasma therapy could really work out towards those
Uh,
factors? Yeah.
because COVID-19 plasma, even we used in at the time of Ebola and MERS. Okay. So if we are dealing, because if the antibody of that particular strain is present in the plasma, then it is going to be help. Otherwise, if you're talking right now, I am having some plasma, but that is only for the research purpose. We are not going to issue this plasma to the for the next wave. Okay, so most of the time, the stain specific plasma, if the antibody for that particular stain is present in the plasma, then it is going to be beneficial. Or if we are going to deal with some other novel disease, so till the time of active vaccination, it is definitely going to be help. Because what is the plasma is nothing. If you are recovering, what is the convergent plasma? If any patient got infection and recovered from that particular disease, so this is the beauty of your body, ki your body is having certain antibodies, and if these antibody in the present in the plasma transfused to the another patient who is having the same disease, it may give some beneficial effect in terms of passive immunization.
Wonderful. Yeah, I understand. Yeah, very good. Yeah. Uh, Thank you. Thank you so much, Ram,
Thank
for
you.
these wonderful insights amid your busy schedules. Before we say goodbye, let's assume that there are no other questions from the audience. But do you have any quick comments, Ram? A final
Yes,
word?
my comment is this: ki, we are scientists because I did my MBBS, MD, and I am still having passion of science. Because if we wanted to name our country, we had to give our best, and we are able to give our best only when we are having passion for that particular thing which I like most. Okay, if you have passion for electrical science, if you have passion for hematology, if you are having passion for computational science, to just you go ahead and make a dream, make a passion to achieve your dream higher. Okay, so this is my message to all of you. Just be humble and have a sense of gratitude to all your seniors, all your mentors, all your teachers, and work hard. Definitely you will get success, and whatever you think you will achieve in certain specified time.
Thank you so much, Ram. Just there's one question from Jaykishan Solanki, who is a young grad whom I mentored as well. He has a very
No,
yeah,
no,
yeah,
no. Straightforward no.
yeah. That is what I was about to say. So
Because why no? Because plasma, when we collected the plasma, so we can concentrate, we can derive IVIG, some kind of IVIG medicine immunoglobulin, we can make it from plasma. But when we are talking about the vaccine, the vaccine is having different profile. Vaccine, we need to be active culture and all these things. So that is not possible to derive from the plasma. But yes, we can concentrate and we can make a immunoglobulins which may help in that particular disease.
thank you. Thank you so much, Ram. One final comments. In fact, I admire Ram very much in many ways. Usually, I usually donate blood every 3 months, and that is an obvious place where I used to go. That's a lovely place. And second thing is, Ram and I, we share one equivocal thoughts. We're of same age. That's the beauty. Number two, he also admires Mahatma Gandhi ji a lot. I'm also a big fan of Mahatma Gandhi ji, and especially the last quotation that he says, that in the service of others, if you are putting yourself in the service of others, that's the greatest thing that you can achieve. And that is what he has been doing a human service over the years. I cannot tell you. So if you are in Jaipur, or even if you are in any meteorological conference, you'll definitely see Dr. Ram Mohan Jaiswal's name. Please happen to meet him. Please happen to interact with him. Please, I would say, learn from his, wonderful tutelage, wonderful, down to earth, how he respects his mentors, how he respects his mentees, how he respects his senior residents. That's quite amazing. And I haven't seen any doctor, such as, Ram, at least in my capacity. Yeah. Thank you so much, Ram.
Thank you, thank you,
I'm
thank
बहुत,
you,
grateful है आपके, wonderful time and energy. Thank you
thank
so
you,
much, and please,
thank you, and Shubh Ratri.
yeah, please continue doing your wonderful time. Thank you
Thank
so
you,
much.
thank you.
So over to you, friends. 1 minute, Ram. 1 minute. I'm sorry,
Please,
all
please.
of you. I forgot. Please, let's have a wonderful photograph with Ram. At least I want to have it. Ram, please, would you mind
Yeah,
stopping
sure,
the
sure, sure, sure.
screen? एक बार screen stop कर लीजिए एक बार, please.
Okay.
Yeah. All of you, please switch on your camera, please. Yeah.
Raj, one final comment from my side. If any one of your student is wanted to come and visit and work with us, are welcome. Or if
Very much.
anyone wanted to come in Jaipur to see our infrastructure, because even few foreign nationals are visiting regularly to see our infrastructure, how we developed in a very short span of time.
I know. That's quite amazing thing. But एक सुझाव था राम, एक स्टूडेंट है वो आपके साथ काम कर सकता है क्या?
हाँ, बिल्कुल कर सकते हैं.
लेकिन थोड़ा वो एज्ड है, वो 44 इयर्स है.
नहीं, एज ए साइंटिस्ट किस फील्ड में काम करना चाहता है वो?
वो बंदा है 44 इयर्स है और वो आपके सामने.
Age doesn't matter.
Okay.
I know. We are already working. We are already working.
Yeah, thank you so much.
Thank you. Thank you. Have it.
1 minute. Say cheese, all of you. Quick photograph, please, all of you, please. Yes. Thank you so much, Vrinda, for joining. Jai Kishan, आपका camera, Manjari or Nayaz, Chandramani, please. Yeah. Sabarno. Okay. Ayraj, you'll be missing this. Okay, I'm sorry for this. You'll be missing this great thing. I'm taking it. I'm taking the photograph. Yes. Thank you. Thank you so much,
All
Ram.
fortunate to have Prash like mentor with you.
Or nine, not at all. Thank
Thank
you.
you.
Thank you so much, Ram.
Thank you.
Very kind of you.
Thank you.
Thank you, Rajul, for the wonderful recording. Thank you so much for your time. Yeah.